So a pleasant afternoon to each and every one of us, especially to our dearest Dean of the College of Radiologic Technology, Ma'am Maricel Pagal. Good day po, ma'am. Hoping everyone's doing great despite of the pandemic we are experiencing. Always observe health protocols to avoid the spread of coronavirus. So the effects of radiation are basically divided into two. The deterministic effect, which was discussed by the first group, and the stochastic effect, which we are going to expand our thoughts and ideas for us to become more knowledgeable. So the principal stochastic effects of low-dose radiation over long period of time consists of the radiation-induced malignancy and genetic effects. Lifespan threatening and effects on local tissues also been reported as stochastic effects, which we are going to explain after we go along with this report. So the epidemiologic studies of people exposed to radiation are difficult because, number one, the dose usually not known but is presumed to be low, and number two, the frequency of response is very low. So consequently, the results of radiation epidemiologic studies do not convey the statistical accuracy associated with observations of stochastic radiation effect. So let's go on and define what stochastic effect is. The stochastic effect are the effects that occur by chance and can occur at any dose. Ito ay nagaganap ng di sinasadya at maaaring mangyari sa anumang doses. Not the severity, but the chance increases with radiation dose. Stochastic effect can be divided into two main categories: the somatic stochastic effect and the genetic stochastic effect. Under the somatic effect, it is the induction of cancer or simply giving rise to cancer. Example of cancers are breast cancer, thyroid cancer, skin cancer, lung cancer, and many more cancer to mention. So under the genetic effect, it is the mutations in genes or chromosomes that can be passed on to the offspring or babies. So we have here the local tissue effects. So local tissue effects, these are the effects observed in skin, chromosomes, and cataracts. Unahin po muna natin si skin. So our skin is the largest organ of the body and also the organ that comes into contact with the outside world. Napakalaki ng role ng skin sa ating katawan. Pero napaka-vulnerable din nito kasi na-expose siya sa outside world, which is ang daming kailangang consider na factor. In addition to the deterministic effect of erythema, desquamation, and late developing carcinoma, chronic irradiation of the skin can result in severe non-malignant changes such as discoloration, aged appearance, and severe drying and cracking. For more information, I will discuss to you the following: erythema, desquamation, late developing carcinoma, discoloration, aged appearance, and the severe drying and cracking. So under the erythema is a form of skin rash caused by blood capillaries that have been injured or inflamed. Ito ay isang uri ng pantal sa ating balat na sanhi ng sugat o namamagang ugat sa katawan. Normally, happens as a result of medicine, diseases, or illnesses. The severity of rash can range from mild to life-threatening. Ang tindi ng pantal ay maaaring simple lang hanggang sa pagbabanta ng ating buhay. Number 2 is the desquamation. It refers to the peeling of sheets of scale after an acute injury to the skin. Example of this is burn, toxic drug reaction, and scarlet fever. So desquamation, from its definition, parang napaka-grabe ng skin disease na nangyayari dito. Pagbabalat ng ating balat pagkatapos ng isang matinding pinsala gaya ng pagkasunog, nakalalasong reaksyon ng gamot at iba pa. So the late developing carcinoma. Skin cancer or the irregular growth of skin cells is not commonly profound on sun-exposed skin. Cancer sa balat o irregular na paglaki ng mga cell ng balat na karaniwang makikita sa parte ng katawan na siyang nasisinagan ng araw. This common type of cancer may also develop on parts of your skin that aren't normally exposed to the sun. Ito din ay pwedeng ma-develop na cancer sa mga parte ng ating katawan na hindi masyadong na-expose sa sinag ng araw. Basal cell carcinoma, squamous cell carcinoma, and melanoma are the three most common types of skin cancer. So take note guys, basal cell carcinoma, squamous cell carcinoma, and melanoma are the three most common types of skin cancer. So, na-mention ko a while ago yung chronic irradiation of the skin cell can result in severe non-malignant changes such as discoloration, aged appearance, and severe drying and cracking. So, discoloration, any abnormal color appearing in or upon the human body. It can be localized like black eye, razor burn. Others are general such as liver mortis, dehydration, and jaundice. Number 2 is the aged appearance. Aging changes in the skin are a group of common conditions and developments that occurs as people grow older. Skin changes are among the most visible signs of aging. Evidence of increased age includes wrinkles and sagging skin. Number 3 is the severe drying and cracking. Cracked skin is a classic symptom of dry skin, but it can also occur in response to scratches or other trauma or infection. When the skin dries, it can become rough and flaky with small tears that can lead to deeper cracks called fissures, which can extend into the deeper layers of the skin. So the stochastic effect of extreme non-malignant changes on the skin as part of local tissue damage is known as radiodermatitis. So radiodermatitis is the integumentary system response to ionizing radiation exposure. Effects can range from erythema to desquamation and necrosis. This response can cause significant pain and limitation of usual lifestyle activities.
Chromosomes. Even in a low dose of radiation can produce chromosome aberrations that may not be apparent until many years after radiation exposure. For example, individuals irradiated accidentally with rather high radiation doses continue to show chromosome abnormalities in their peripheral lymphocytes for as long as 20 years. Here, we have discussed already in our past lesson that DNA is the most radiosensitive of all macromolecules, and that's why it's called the target molecule, because it contains genetic information for each cell. And each cell has nucleus that contains DNA complex with other molecules in the form of chromosomes. And these chromosomes control the growth and development of the cell and determine the characteristics of individuals. So, if there's an abnormal metabolic activity in the DNA, then there's a chromosome aberrations or the cytogenic damage. From the word cyto means cell, then it's a damage in cell. Even in a low dose of radiation, the cells irradiated or cells exposed to radiation, either in higher or lower radiation, can show chromosome aberration that isn't yet obvious seen by the person exposed to that radiation until the years come. These chromosome aberrations are abnormalities in the chromosomes of one person. Example, for pregnant when exposed to radiation, wherein the chromosomes rejoin in different patterns rather than in their original arrangement. Example, in the DNA replication, in meiosis and mitosis, there's a pairing of sister chromatids, right? Then, wherein, imbes na pumunta sila sa original arrangement nila is napupunta sila sa wrong pairing. Broken off, pwedeng maging deleted, then, there's a chromosome aberration. Example of chromosome aberrations are changes in chromosome number na maaring mag-gain or lose, and changes in structures. Example, deletion, chromosomes are missing or deleted, dysentery, chromosomes have 2 centromeres, ring formation, portion of chromosomes has been broken off and form a circle or ring. And others are inversion, translocation. In vitro irradiation experiments using blood lymphocytes can provide dose relationship that can be used to estimate radiation dose to individuals on the basis of aberration frequency detected in their lymphocytes. I'll just differentiate vitro from vivo. The vitro irradiation experiment called is a test or experimentation outside the living organism, and such thing being tested are the blood, dead cells that are taken off from the body for experiments, which are confined in the test tubes or laboratory dishes, while vivo experimentation it's a live experimentation inside the living organisms of human or animal, like injecting something inside the body of human or animal for medical experiments. Lymphocytes called are kind of white blood cells or the soldiers of blood, producing antibodies that fights against infections, bacteria, viruses, and others. So, this lymphocyte is used to estimate radiation dose to individuals as basis if there's an aberration. So, if aberration is detected in the lymphocytes being tested, then that person have chromosome aberration. These chromosome aberrations usually happen to women or pregnant exposed to even in a low or high dose of radiation. The result of these chromosome abnormalities have either extra or lack chromosomes, are called Down syndromes, Turner syndromes, dwarfisms, and others. Next slide. Cataracts. Sabi nga ni Nelma nung past lesson that cataracts are clouding of the lens of the eye. And most cataracts develop slowly over time, causing symptoms of blurry vision. The lens of the eye is considered as vulnerable because it is avascular. Avascular means lack of blood cells. After effects of radiation exposure may appear after latent of 17 years. The latent period na sinasabi na tinatawag or sinasabi is the time after exposure, during which there is no sign of radiation sickness. Here in cataracts, a thing was invented, used in imaging procedure to treat this cataract and others. In 1932, Ernest Orlando Lawrence of the University of California developed the first cyclotron, a 12 cm diameter device capable of accelerating charged particles are used as high energies. Modern cyclotron is used to produce radionuclides for use in nuclear medicine, especially fluorine-18 for positron emission tomography. Here, this cyclotron is a type of compact particle accelerator which produces radioactive isotopes that used for imaging procedures. Examples for therapies. Cyclotrons produces beam of protons, alpha particles, or other heavier nuclei that are used for treatment in imaging procedures in cataracts, cancer, and others. So, in 1939, ginawaran si Ernest Orlando Lawrence ng Nobel Prize in Physics for his invention of cyclotron. At ang kanyang kapatid na si John Lawrence, a doctor of medicine, was the first physician to apply radionuclides on human disease. That's why he is considered the father of nuclear medicine. Here, after he administered the first radioactive treatment for a patient suffering from leukemia, his laboratory is considered also as birthplace of this field of medicine. Next slide. For more info, the largest particle accelerators in the world are located at Argonne National Laboratory in United States and at CERN in Switzerland, or the Conseil Européen pour la Recherche Nucléaire, or the European Organization for nuclear research. These accelerators are used to discover the ultimate fine structure of matter and to describe exactly what happened at the moment of creation of the universe. Early cyclotrons were located in one room, and a beam of high-energy particles was extracted through a tube and steered and focused by electromagnets onto the target material in the adjacent room. These particle accelerators pose hazards also because they emit ionizing radiation and can produce radioactive waste. However, regulations and good safety practices ensures workers and public, of course, protected when these particle accelerators are running. Radiographic intensifying screen is a tool of radiologic technologists used by cyclotron physicists to aid them in locating the high energy beam. Unfortunately, these physicists receive high radiation doses to the lens of their eyes because they had to look directly into the beam. Dito, because the lens of the eyes of the cyclotron physicists were exposed to the beam of the radiographic intensifying screen with high radiation dose, they were reported to have cataracts in 1949. And by 1960, several hundred cases of radiation-induced cataracts had been reported. This was tragic because meron lang kokonting high-energy physicist doon. And on the basis of animal experimentation and observation, conclusions can be drawn concerning radiation-induced cataracts. The radiosensitivity of the lens of the eye is age-dependent, meaning, as age of a person increases, the greater radiation effect is and latent period becomes shorter. Yung latent period na sinasabi ko kanina is, it's the time after exposure, during which there is no sign of radiation sickness. Radiation administered to patients in computed tomography or CT, the lens dose can be 50 milligray or equivalent to 5 rad. However, in computed tomography, it is common to modify the examination to reduce the dose to the eyes. Next slide.
To sum up the local tissue effects on the skin, erythema is the reddening of the skin, desquamation, ulceration, and denudation of the skin. Other non-malignant changes: callous, discolored, weathered look on arms and forearms. Skin becomes light and brittle, may crack or flake. Irradiation of blood-forming organs cause, at early response, it is the hematologic depression, and at the late response, it is the leukemia. In chromosomes, low dose can produce aberrations not apparent for years. Cataracts can be radiation-induced. The radiosensitivity of the lens of the eye is age-dependent. Increased age, increased radiation effect. And as we increase age, it decreases the latent period. High LET radiation, example of this is the neutrons, have high RBE for production of cataracts.
Okay, lifespan shortening. So what does it mean when we say lifespan shortening? Radiation-induced lifespan shortening is non-specific, that is, no characteristic diseases are associated with it. And it does not include late malignant effect. Lifespan shortening occurs simply as accelerated premature aging and death. So sabi dito, ang lifespan shortening daw ay hindi patiyak, na walang katangian na sakit na nauugnay dito at hindi raw kasama rito ang mga nakakasamang epekto katulad nga ng radiation kung saan-saan natin nakukuha o naa-adapt. Sabi rin dito na ang lifespan shortening daw ay nangyayari o nagaganap ng simple lamang tulad ng pinabilis na wala sa panahong pagtanda at pagkamatay. Next slide. There have been animal experiments conducted for both acute and chronic exposure that show that irradiated animals die young. And the dose response in these experiments is a nonlinear threshold. So what do we mean when we say nonlinear threshold? A nonlinear threshold is most commonly used model to estimate the biological risk from ionizing radiation. This model is used based on biological responses at high radiation doses and dose rate. Of course, kung mas mataas ang dose and dose rate, mas mataas din ang kanyang biological rate. Kung mas mababa naman ang dose and dose rate, mas mababa din ang kanyang biological rate. So the graph here at my back or side shows the representative result of several experiments with mice o daga. Next slide. The data presented in table 34.2 in our Bushong books were compiled by Cohen of the University Pittsburgh and were extrapolated from various statistical sources of morality. And sabi dito na ang inaasahang buhay na nawala o mawala sa isang araw is given as a function of occupation, diseases, or other conditions. As we can see, na ang pinakapangit daw na peligro ay ang maging isang lalaki kaysa maging babae. Samantala, ang average rate naman ng pag-ikli ng haba ng buhay na dulot ng mga aksidente sa trabaho ay umabot lamang sa 74 days at for those radiation workers, bumaba o lumiit ang kanilang tsansang mabuhay sa 12 days lamang. Next slide. So this table shows the result obtained when the age at death for radiologists was compared with the age at death for the general population. Radiologists dying in the early 1930s were approximately 5 years younger than members of the general population who died at the average age. However, this difference in age at death had shrunk o lumiit sa bilang na zero noong taong 1965. And lastly, I just want to clarify that radiologic technology job is a safe job for all. Next reporter.
So we proceed to risk estimates. What is risk estimates? So it is a forecast of the probability and impact of risk. The deterministic effects of high-dose radiation exposure are usually easy to observe and measure. So the stochastic effects are also easy to observe, but it is nearly impossible to associate a particular rate response with the previous radiation exposure. So there are 3 types of risk estimates. So we have here relative, excess, and absolute risk. So all of this represents different statements of risk and have a different dimensions. So the first one is the relative risk. So relative risk is computed by comparing the number of persons in the exposed population showing a given stochastic effect with the number in an unexposed population who show the same stochastic effect. So it is calculated when the population radiation dose is not known. So kailan natin ginagamit ang relative risk? If one observed a large population for stochastic radiation effects without having any precise knowledge of the radiation dose to which they were exposed. So, for further understanding, we have here the formula of relative risk. Relative risk is equal to observed cases over expected cases. So, we have here example. In a study of radiation-induced leukemia after diagnostic levels of radiation, 227 were observed in 100,000 persons so irradiated. The normal incidence of leukemia in the US is 150 cases per 100,000. On the basis of this data, what is the relative risk of radiation-induced leukemia? So the answer is, using the formula, relative risk is equal to observed cases over expected cases. We have here 227 cases observed over 100,000 persons so irradiated. So divide po natin siya sa 150 cases over 100,000. So 227 divided by 150 is equal to 1.51. So our relative risk of 1.0 indicates no risk at all. So 1.0 daw po is no risk at all. So a relative risk of 1.5 indicates that the frequency of a late response is 50% higher in the irradiated population than in the non-irradiated population. The relative risk for radiation-induced stochastic effects of particular importance observed in human population is in the range of 1 to 2. Okay, so some evidence supports the principle of radiation hormesis. Radiation hormesis suggests that low levels of radiation, so less than approximately 100 milligray or 10 rad, are good for you. So such low doses may provide a protective effect by stimulating molecular repair and immunologic response mechanism. Nevertheless, radiation hormesis remains a theory at this time and until it has been proved. So we will continue to practice ALARA, which means as low as reasonably achievable. So the theory of radiation hormesis suggests that very low radiation doses are beneficial. So let's proceed to the second type of risk estimate, excess risk. So it refers to the excess rate of occurrence of particular health effects associated with exposure to radiation. So it determines the magnitude of the stochastic effect as the difference between cases and the control subject. Often when an investigation of human radiation response reveals the induction of some stochastic effect, the magnitude of the effect is reflected by the excess number of cases induced. So, leukemia, for instance, is known to occur spontaneously in non-irradiated population. If the leukemia incidence in an irradiated population exceeds that which is expected, then the difference between the observed number of cases and the expected number would be excess risk. So the excess cases in this instance are assumed to be radiation-induced. So to determine the number of excess cases, one must be able to measure the observed number of cases in the irradiated population and compare with the number that would have been expected on the basis of known population levels. So the further understanding, we have here the formula. Excess risk is equal to observed cases minus expected cases. So we have here the example. So 23 cases of skin cancer were observed in a population of 1,000 radiologists. The incidence in the general population is 0.5 over 100,000. So how many excess skin cancers were produced in the population of the radiologists? So the answer is, using the formula, excess risk is equal to observed cases minus expected cases. So we have here 23 over 1,000, which is the 23 cases of skin cancer were observed in a population over 1,000 radiologists, minus 0.5 over 100,000. So 23 minus 0.5 is equal to 23. So, saan po natin nakuha yung 0.005? 23 less 0.5 is equal to 0.005. So, 23 minus 0.005 is equal to 23. Bakit 23 pa rin po yung answer? Because none would be expected. All 23 cases represent radiation risk. So, what is the difference between relative risk and excess naman po? So, the difference between the relative risk and excess risk is based on known dose, yun yung relative risk. Sa excess risk naman is simply the number of malignancies observed that exceed the naturally occurring expected number of malignancies. So, let's proceed to the third types of risk estimate. Absolute risk. So, to determine absolute risk, one must assume a linear dose-response relationship. If the dose-response relationship is assumed to be non-threshold, then only one dose level is required. So, the absolute risk of total radiation-induced malignant disease has been determined by the National Academy of Science, or NAS, Committee on the Biologic Effect of Ionizing Radiation, or the BEIR. So, in contrast to the relative risk, which is dimensionless ratio, the absolute risk consists of unit of cases, population, and the dose. So, if at least two different dose levels are known, then it may be possible to determine an absolute risk factor. So, we have here the radiation-induced incidence and mortality risk coefficient. So, as we can see, the slope of the linear non-threshold dose response relationship is equal to the absolute risk. Okay? So, letter A and B show absolute risk of 3.4 and 6.2 cases per 10 to the 10 to 6 persons per rad per year respectively.
Radiation-induced malignancy. What is radiation? Radiation is the energy that comes from a source and travels through space and may be able to penetrate various materials. Light, radio, microwave are types of radiation that can call non-ionizing. How about induced? Induced to provide by induction induce an electric current. And how about malignancy? A term of disease in which abnormal cell division without control and can invade nearly tissues. Malignancy cell can also spread to other parts of the body through the blood. So, radiation-induced malignancy have been observed in experimental animals, and on the basis of this animal experience, dose-response relationship have developed. At the human level, this stochastic effect have been observed, but often data are insufficient to allow precise identification of the dose-response relationship. Consequently, some of the conclusions drawn regarding human response are based in a part of animal data. So let's proceed to leukemia. Leukemia is a type of cancer that affects the blood and bone marrow. Leukemia begins in a cell, the bone marrow. The cell undergoes a change and becomes a type of leukemia cell. Once the marrow cell undergo a leukemia change, the leukemia cell may grow and survive better than normal cell. The bullet number 1, radiation-induced leukemia follows a linear and non-threshold dose-response relationship. The other one is radiation-induced leukemia is considered to have a to have a latent period of 4 to 7 years and an at-risk period approximately 20 years. The third one, studies of radiation-induced leukemia among American radiologic technologies consistently show no evidence of any radiation effect. And the last one, radiation therapy was a permanent cure and remained the treatment of choice of approximately 20 years until it was discovered that some of had been cured by radiation were dying from leukemia. So ano nga ba ang leukemia? Ang leukemia ay isang uri ng cancer na kung saan apektado ang mga tissues sa katawan ng responsible sa paggawa ng dugo, kasama na ang bone marrow at sistemang limpatiko. Maraming uri ng mga leukemia. Ang mga uri ng leukemia ay kadalasan sa matatanda at meron din sa mga bata. Sa leukemia, kadalasan ng sangkot ang puting selula ng dugo na tinatawag white blood cell. Ang puting selula ng dugo ay isang mabagsik na panlaban sa mga impeksyon pumapasok sa katawan ng kadalasang dumadami sa pag-aayos ng paraan, lalo na kung kailan ito ay katawan kapag may impeksyon. Subalit, sa mga taong may leukemia, ang bone marrow ay gumagawa ng puting selula sa hindi normal na dami na hindi gumagana ng maayos. Ang gamutan sa sakit ng leukemia ay isang komplikadong usapin, depende kung anong uri ng leukemia at iba pang mga salik. Subalit may mga pamamaraan naman para gawing matagumpay ang iyong gamutan. Ano nga bang mga sintomas ng leukemia? Ang mga sintomas ng leukemia ay iba't iba. Depende sa kung saan anong uri ng leukemia ang tumatama sa pasyente. Narito ang mga halimbawa ng sintomas ng leukemia. Lagnat at panginginig, madalas at malalang kaso ng impeksyon, pagbaba ng timbang, pagdurugo at mga pasa, pabalik-balik ang mga durugo ng ilong, pananakit ng buto. Ano nga ba ang kailangan dapat magpatingin sa doktor kung meron kang mga sintomas na kakahabala sa iyo. Ano nga ba ang sanhin ng leukemia? Sa pagkahalatang sinasabing ang leukemia ay nabuo kapag ang ilang selula ng dugo ay nagkakaroon ng mutation sa kanilang DNA. Ang code na sinusunod ng mga selula sa lahat ng mga gawain nito. Ano nga bang mga uri ng leukemia? Ito ang mga halimbawa. Acute leukemia, chronic leukemia, lymphocytic leukemia, myelogenous leukemia. Let's proceed to cancer. Ang cancer ay disease caused by a uncontrolled division of abnormal cell in a parts of the body. Number 1 bullet. Radiation-induced leukemia also can report of radiation-induced cancer. We do not have similar qualities of human data regarding cancer as we do for leukemia. Nevertheless, it can be said without question that ionizing radiation can cause cancer. Approximately 20% of the deaths are caused by cancer. Therefore, any radiation-induced cancers are obscures. And the third bullet, when indigested, the radium becomes metabolic similar to calcium and deposit in bone. The other one, radiation-induced skin cancer follows a threshold dose-response relationship. The last one, radiation-induced breast cancer exhibit a linear and non-threshold dose-response relationship. So, ano nga ba ang cancer? Ang cancer ay hindi normal na pagdami ng mga mapaminsalang selula sa katawan. Ang katawan ng sakit na ito ay nagmula kay Hippocrates
nang ginagamit niya ang mga salitang carcinos at carcinoma para ilarawan ang mga tumor. Ang mga ito ay patuloy na dumadami hanggang sa hindi nagagawa ng particular na bahagi ng katawan ang maaayos sa paggana nito. At kapag hindi ito naagapan, ang cancer ay matutuloy sa advanced stage nito at maaaring nagdudulot ng kamatayan. Ang mga katangian ng cancer. Ang mga sintomas ng cancer ay batay sa kung aling bahagi ang katawan ng apektado nito. Subalit halos lahat ng uri ng mga cancer ay nagdudulot ng magkakaroon ng mga pagbabago ng katawan. So number 1, pagkakaroon ng bukol o pamamaga sa ilang bahagi ng katawan. Pangalawa, pananakit sa bahaging apektado. Pangatlo, pagkakaroon ng dugo sa ihi, hematuria, o di naman kaya dumi, hematoxia, labis na namamalay. The last one, pagbabago ng kulay ng balat. Ano nga ba ang sanhi ng cancer? Marami ang mga dahilan kung bakit nagkakaroon ng mga tao ng cancer. Dahil sa paninigarilyo, malabis na pag-inom ng mga nakakalasing na alak, pagkalantad sa mga carcinogen. Ang mga carcinogen ay mga sangkop, lalo na ang mga industrial na chemical na pumipinsala sa mga selula ng katawan. Sunod, kakulangan ng nutrisyon, kakulangan ng pagkilos ng katawan. Ito ang mga salik sa pagpapataas ng posibilidad ng magkakaroon ng mga cancer. Simulan natin sa mga edad, kapaligiran, kalagayan ng kalusugan, pagkakaroon ng cancer sa pamilya. Ano nga ba ang lunas nito? Nilulunasan ang mga cancer sa pamamagitan ng pamamaraang chemotherapy, radiation therapy, operasyon or stem cell transplant, at immunotherapy. So many types of cancer have been implicated as radiation-induced, and a discussion of more important ones in order. Meron tayong thyroid cancer, has been shown to develop in 3 groups of patients should thyroid glands were irradiated in childhood. Pangalawa is skin cancer, usually begin with the development of radiodermatitis. The third one, breast cancer. Radiation-induced breast cancer has also been observed among atomic bomb survivors. And the fourth, lung cancer incidence in the general population was negligible by comparison. The industry in mine environment was considered to be the cause of these lungs. Now, it is known that radiation exposure from radon in the mines contribute to the incidence of lung cancer in these mines. So, let's proceed to radon, 222Rn. Is an alpha-emitting radionuclide that absorb on the particles with log in the alveolar space of the lungs. When the breathe in radon, it gets into the lining of your lungs and give off radiation. Over a long time, that can damage the cell and the lead of lungs cancer. Radon is the second biggest cause of lung cancer after cigarette smoking. Torotrates, thorium dioxide, THO2, in colloid suspension known as torotrates was widely used in diagnostic between 1925 and 1945 as a contrast agent of angiography. Torus was approximately 25% THO2 by weight contains several radioactive isotope of thorium and its decay product.
So let's move on to total risk of malignancy. On the basis of many of these observations on human population groups after exposure to low-level radiation, and considering all the risk estimates taken collectively for leukemia and cancer, a number of simplified conclusions can be made. So as you can see, may nakikita kayong solutions dito which is pinapakita if how much the total number of population's death during the incidence of 3 Mile Island. But before we discuss these solutions, allow me to read you a short background of these incidents. The over absolute risk for induction of malignancy is approximately 8 cases per 100 shivered, with the at-risk period extending for 20 to 25 years after exposure. To make these values somewhat more meaningful, we can consider the celebrated 3 Mile Island incident in 1979. Approximately 2 million people resided within 50-mile radius of 3 Mile Island on the Susquehanna River in Pennsylvania. During the total period of the radiation incident, the average dose to persons living within a 160-kilometer or 100-mile radius was 15 milligray or 1.5 mrad. By applying 15 milligray as the population dose, one can predict that 3 Mile Island incident will result in no more than 2 additional malignant deaths as a result of this population radiation exposure. So this is how I get the total number of deaths. So 2 times 10 to the 6th power times 5 divided by 10 to the 4th power divided by 10 times 0.015. 2 times 1 million times 5 divided by 10,000 divided by 10 times 0.015. So yung 1 million nakuha ko dito sa 10 to the 6th power. 10 times 10 times 10 times 10 times 10 times 10 is equal to 1 million. And 10,000 is nakuha ko rin dito sa 10 to the 4th power, which is 10 times 10 times 10 times 10 is equal to 10,000. So 2 times 1 million is equal to 2 million times 5 divided by 10,000 divided by 10 times 0.015. And 2 million times 5 divided by 10,000 is equal to 1,000 divided by 10 times 0.015. So 1,000 divided by 10 is equal to 100 times 0.015 is equal to 1.5. So the risk of death from radiation-induced malignant disease is 5 cases per 100 shivered. Expressed more simply, an effective dose of 10 millishievert, a single CT scan carries a risk of approximately 8 over 10,000 for malignant disease induction, so half of whom will not survive. Next topic is the BEIR Committee. The committee members on the biologic effect of ionizing radiation, or BEIR, an arm of the National Academy of Sciences, has reviewed the data on stochastic effects of low-dose, low-let radiation. The BEIR Committee also has analyzed available human data with regard to age at exposure, a limited time of expression of effects, and whether the response was absolute or relative. The BER committee members examined 3 situations on the table. First, they estimated the excess mortality from malignant disease after a one-time accidental exposure to 100 milligray. Such a situation is highly unlikely in radiology. Second, they considered the response to a dose of 10 milligray per year for life. This situation is possible in diagnostic radiology but rare. Finally, they considered excess radiation-induced cancer mortality after a continuous dose of 1 milligray per year. Ito ay mas mataas pa rin kaysa sa karanasan ng karamihan sa mga radiologic technologies, ngunit maaaring magsilbing isang mabuting limitasyon pagdating sa pagtatrabaho ng radiation. So, the BEIR committee has further stated that because of the uncertainty in its analysis, less than 10 milligray may not be harmful.
Radiation in pregnancy. Since the first medical applications of X-rays concern an apprehension of arisen regarding the effects of radiation before, during, and after pregnancy. Before pregnancy, the concern is interrupted fertility. During pregnancy, concern is directed to possible congenital effects in newborns. Post-pregnancy concerns are related to suspected genetic effects. So all these effects have been demonstrated in animals, and some have been observed in humans. Now let's talk about the effects of radiation on fertility. So there is an example evidence that such an effect occurs and is related to the radiation dose. However, the effects of long-term, low-dose radiation in fertility are less well defined, while animal data are lacking in this area. Those that are available indicate that even if the radiation is given off at a rate of 1 sievert per year, there is no noticeable decrease in fertility. So this only means one thing. Low-dose chronic irradiation does not impair fertility. But according to the internet, according to the National Cancer Institute, many cancer treatments can affect a boy's or a man's fertility. So sabi po doon, it may lower fertility or cause infertility. Cancer treatments are important for future health, but they may harm reproductive organs and glands that control fertility. Changes to fertility may be temporary or permanent. So here are some of examples of treatment and its effects. First one, we have chemotherapy. So chemotherapy can damage sperm and sperm-forming cells in young boys. Next, we have radiation therapy. Radiation therapy to the reproductive organs as well as radiation near the abdomen, pelvis, or spine may lower sperm counts and testosterone levels, causing infertility. So radiation may also destroy sperm cells and the stem cells that make sperm. Radiation therapy to the brain can damage the pituitary gland and decrease the production of testosterone and sperm. Also, stem cell transplants such as bone marrow transplants and peripheral blood stem cell transplants involve receiving high doses of chemotherapy and or radiation. These treatments can damage sperm and sperm-forming cells. Moving on, let's talk about the effects of radiation in utero. But before that, let me give you a short general background about it. Prenatal doses for most properly done diagnostic procedures present no measurable increased risk of prenatal death, malformation, or impairment of mental development over the background incidence of these entities. Higher doses, such as those involved in therapeutic procedures, can result in significant fetal harm. Also, there are radiation-related risks throughout pregnancy, which are related to the stage of pregnancy and the fetal absorbed dose. So radiation risks are most significant during organogenesis and the early fetal period, somewhat less in the second trimester, and least in the third trimester. So the effects of radiation in utero are time-related and radiation dose-related. They include prenatal death, neonatal death, congenital abnormalities, malignancy induction, general impairment of growth, genetic effects, and mental retardation. So to elaborate more about this topic, may we hear it from Jubilee, the next reporter.
Irradiation in utero. Effects of utero irradiation. Both cell-killing effects and induction of neoplasms may occur as a result of in utero irradiation. Ang parehong mga epekto sa pagpatay ng cell at induction ng neoplasms ay maaaring mangyari bilang isang resulta ng utero irradiation. Clinical radiation effects are due either to 1. Cell killing, or 2. Unrepaired or misrepaired DNA damage. Effects due to cell killing have a practical threshold below which the effect is not seen. The higher the dose, above that threshold, the more severe is the effect. Leukemia, cancer, and potential hereditary effects are due to unrepaired or misrepaired DNA damage. The probability of such an effect occurring increases with dose, and there is no identifiable able threshold dose below which the chance is known to be zero. Protracted radiation exposures may occur during pregnancy. In general, for a given period of gestation, protracted exposures probably have less overall effect than a brief radiation exposure of high intensity. Above a practical threshold, damage from ionizing radiation during pregnancy that results in cell killing can cause a wide range of effects, including lethality, central nervous system abnormalities, cataracts, growth retardation, malformations, and even behavioral disorders. Sa itaas ng isang practical na threshold, ang pinsala mula sa ionizing radiation sa panahon ng pagbubuntis na nagre-resulta sa pagpatay ng cell ay maaaring maging sanhi ng isang malawak na hanay ng mga epekto, kabilang ang pagkamatay, mga abnormalidad sa gitnang sistema ng nerbiyos, cataract, retardation sa paglaki at malformations. Since the fetal neural system is most sensitive and has the longest period of development, radiation-induced abnormalities are rarely seen in humans without neuropathology. This syndrome is recognizable but can also be produced by other noxious agents. The effects of exposure to radiation on the conceptus depend on the time of exposure relative to conception and the amount of absorbed dose. Ang mga epekto ng pagkakalantad sa radiation sa konsepto ay nakasalalay sa oras ng pagkakalantad na may kaugnayan sa paglilihi at dami ng hinihigop na dosis. When the numbers of cells in the conceptus is small and their nature is not yet specialized, the effect of damage to these cells is most likely to take the form of failure to implant or of an undetectable death of the conceptus. Malformations are unlikely or very rare. Exposure of the embryo in the first 2 weeks following conception is not likely to result in malformations or fetal death, despite the fact that the central nervous system and the heart are beginning to develop in the 3rd week. During the rest of the period of major organogenesis, conventionally taken to be from the 3rd week after conception, malformations may be caused, especially in the organs underdeveloped at time of exposure. Genetic effects. The genetic effects of radiation are inheritable changes, chiefly mutations, produced by the absorption of ionizing radiations. On the basis of present knowledge, these effects are additive or irreversible. Ang mga epekto ng genetiko ng radiation ay minana ng mga pagbabago, higit sa lahat mga mutasyon na ginawa ng pagsipsip ng ionizing radiations. Batay sa kasalukuyang kaalaman, ang mga epektong ito ay additive at hindi maibabalik. Effect of radiation exposure during pregnancy. Depending on the stage of fetal development, the health consequences of exposure at dose greater than 0.5 GY or gray can be severe even if such a dose is too low to cause an immediate effect to the mother. The health consequences can include growth restriction, malformation, impaired brain function, and cancer. Effects of radiation exposure during pregnancy. Depende sa yugto ng pag-unlad ng pagsanggol, ang mga kahinatnan sa kalusugan ng pagkakalantad sa mga dosis na mas malaki sa 0.5 GY ay maaaring maging malubha kahit na ang naturang dosis ay masyadong mababa upang magdulot ng agarang epekto sa ina. Ang mga kahinatnan sa kalusugan ay maaaring magsama ng malformation ng paglilimita sa paglago, kapansanan sa pagpapaandar ng utak at cancer. Example of genetic effects of radiation include cystic fibrosis. Cystic fibrosis is a hereditary disease that affect the lungs and digestive system. The body produces thick and sticky mucus that can clog the lungs and obstruct the pancreas. Cystic fibrosis can be life-threatening, and people with the condition tend to have a shorter than normal lifespan. Phenylketonuria, commonly known as PKU, is an inherited disorder that increases the levels of a substance called phenolalanine in the blood. Phenolalanine is a building block of proteins, an amino acid that is obtained through the diet. It is found in all proteins and in some artificial sweeteners. If PKU is not treated, phenolalanine can build up the harmful levels in the body, causing intellectual disability and other serious health problems. Hemochromatosis. Hemochromatosis is a disorder where too much iron builds up in your body. Sometimes it's called iron overload. Normally, your intestines absorb just the right amount of iron from the foods you eat. But in hemochromatosis, your body absorbs too much and it has no way to get rid of it. Bloom syndrome is a rare genetic disorder characterized by short stature, a sun-sensitive red rash that occurs primarily over the nose and cheeks, mild immune deficiency with increased susceptibility to infections, insulin resistance that resembles type 2 diabetes, and most importantly, a markedly increased susceptibility to many types of cancer, especially leukemia, lymphoma, and gastrointestinal tract tumors. Ataxia telangiectasia is a rare inherited disorder that affects the nervous system, immune system, and other body systems. This disorder is characterized by progressive difficulty with coordinating movements, ataxia. Beginning in early childhood, usually before age 5, affected children typically develop difficulty walking, problems with balance and hand coordination, involuntary jerking movements, muscle twitch, and disturbance in nerve function. Effects of radiation on embryo and fetus abstract. The developing embryo and fetus are extremely sensitive to ionizing radiation. The main effects of radiation on the human embryo and fetus. Growth retardation occurs when your fetus doesn't develop at a normal rate. Prenatal occurring or existing before death. Prenatal occurring or existing before birth. Is the regular health care women should receive from an obstetrician or midwife during pregnancy. Prenatal development is the growth of a single-celled zygote formed by the combination of sperm and an egg into a baby. Neonatal death, also called a newborn death, is when a baby dies during the first 28 days of life. Most neonatal death happens in the first week after birth. Neonatal death is different from stillbirth. A stillbirth is when the baby dies at any time between 20 weeks of pregnancy and the due date of birth. Congenital malformations, a physical defect present in a baby at birth that can involve many different parts of the body, including the brain, heart, lungs, liver, bones, and intestinal tract. Congenital malformations can be genetic. It can result from exposure of the fetus to a malforming agent such as alcohol, or it can be of unknowing origin. Mental retardation, the condition of having an IQ measured as below 7 to 75 and significant delays or lack in at least 2 areas of adaptive skills. Mental retardation is present from childhood. Between 2 and 3% of the general population meet the criteria for mental retardation. Causes of mental retardation include fetal alcohol syndrome and fetal alcohol effect. Brain damage caused by the use of prescription or illegal drugs during pregnancy, brain injury and disease, and genetic disorders such as Down syndrome and Fragile X syndrome.
So, ito nga po yung summary ng report namin about stochastic effects of radiation. Radiation protection, guys, are based on the stochastic effects of radiation and on linear non-threshold dose response relationship. Meaning, it refers to the dose relationship response that intersect the dose axis at or below zero. Radiation clearly can produce two different types of damage. Damage due to cells being killed and removed from a tissue or organ was formerly called a deterministic effect but has been renamed a tissue reaction. And the one, an effect due to the cells that are not killed but are changed or mutated, is called a stochastic effect. This category of effect is called stochastic, a word that has been given a special meaning in radiation protection, but in general, just means random. Yung meaning ng stochastic in general term is random. If the radiation damage occurs in germ cells, mutations may occur that could cause deleterious effects in future generations. Stochastic effects of exposure occur a long time after exposure. It can result from higher dose, short-term exposure, but regarding in diagnostic imaging, it involves only low-dose exposure over time. Stochastic responses are cancer, leukemia, or genetic effects. Such responses usually follow low radiation exposure and appear as a late radiation response. Example, one recent early human experience of radiation-induced leukemia and cancer in bone, thyroid, breast, lung, bone cancer is the Japanese survivors of the atomic bomb attacks in Hiroshima and Nagasaki in 1945 at the end of the World War II, are the most important single group studied because of their large number, wherein 210,000 victims died and 210,000 survived, both civilians, radiation workers, or the medical workers. The US deployed atomic bomb in Japan, and many people were killed later of radiation exposure from nuclear radiation released from the bomb. Maraming namatay ng mga tao because sa radiation exposure na nanggaling sa nuclear radiation sa bomba, yung bomba na bumagsak sa lupa. Kaya yun, madaming naapektuhan at namatay na mga tao. The care with which they have been followed, and the fact that people of all ages and both sexes, either female and male, receive a wide range of doses. To date, about 22,000 cancers have been observed in lifespan study, of which about 1,000 are attributable to the radiation exposure, and some women have miscarriage, malignant tumors, chronic diseases, and others because nga sa acute radiation exposure sa mga bomba nung World War II. The weapons used on the two cities were different. The one used in Nagasaki was a type that would be expected to emit E-rays or gamma rays with few neutrons and had been previously tested. So, dosimetry is based partly on measurement. And yung weapon naman na nagamit sa Hiroshima was a type of never tested before or since. So, the dose estimates are based largely on computer simulations. The radiation from this weapon was a mixture of neutrons and E-rays. The dosimetry relating to the atomic bombs has been revised several times over the years, leading to changes in the cancer risk estimates. But now, according to research, background radiation levels are back to normal na sa Hiroshima and Nagasaki and is the same as the average amount of natural radiation present anywhere on Earth. Kaya safe na din sa Hiroshima and Nagasaki ngayon sa Japan. Because since the bomb was detonated in the air, most of the radioactive material stayed in the air and hindi nagsettle sa ground, sa lupa. However, there's an event wherein portion of Ukraine is uninhabited because of the nuclear power plant accident in Chernobyl on April 26, 1986. Sa Ukraine naman, may for additional siyang sa Ukraine, may portion doon na may nuclear power plant accident in Chernobyl. Kung saan yung Chernobyl activity is still circulating up until now. But some small number of people still live there. Konti lang yung tumitira pa rin doon. Kaya itong Chernobyl na to na accident has gone down in history as the world's worst nuclear disaster ever. There are problems included even when many epidemiologic studies have stated positive results. The following are exact dose usually not known, frequency of observable response is low, with stochastic effects, incidence of response is dose related, and no dose threshold is evident. Local tissues can be affected by low radiation dose, as skin shows a callous, discolored appearance and weathered. Stochastic effects appear as non-malignant changes in the skin. Chromosome damage in circulating lymphocytes observed as stochastic effects of radiation exposure. Risk estimates are used to estimate radiation response in population if those response relationships are not precise when stochastic effects of radiation exposure are detected. There are three types of risk estimates that represent different statements of risk and dimension. These are the relative risk, the excess risk, absolute risk na binanggit kanina ni Ira. And the theory of radiation hormesis suggests that very low radiation doses are beneficial, which is less than approximately 100 milligray or equivalent to 10 rad are good for us. Dito, the hypothesis that low levels of radiation are beneficial, activating repair mechanism that protect against disease. The effect of low dose long-term irradiation in utero can include neonatal death, prenatal death, malignancy, impaired growth, genetic effects, and others. Dito, these abnormalities are based on doses greater than 1 gray. Kaya nangyayari itong mga na to, mga death, or mga malignancies or mga impaired growth sa genetic or sa mga genes, ganun. With minimum reported doses in animal experiments at approximately 100 milligray, when large experimental animals population were acutely exposed, the minimum reported dose at which effects were observed as statistically significant was approximately 100 millicare or equivalent to 10 rad. No evidence at the human or animal level indicates that levels of radiation exposure currently experienced occupationally or medically are responsible for any such effect on fetal growth or development. Dito sa mga sinabi ko, pagsamahin ko na, dito, 1 gray is bad for the body because it is equivalent to 100 rad. So, if the dose is exceeded from 100 rad or 1 gray, there's a possibility that a person can vomit, feel dizzy, mahihilo, or magtatae. As the radiation hormesis na sinabi ko nga kanina suggest that less than approximately 100 milligray or 10 rad are okay na sa atin or good na sa atin. And the TVL or threshold limit value is for barriers or shielding. The accepted dose limit for RadTech is average annual dose of 5,000 mrem or 50 millisievert per year. So, if the RadTech expose more than this dose limit na 50 millisievert per year, there's a possibility of a tissue damage can occur. And in general, X-ray workers naman, yung mga nag-ooperate ng CT scan, nuclear medicine, radiation therapy, na nagpo-produce ng X-rays, the dose limit is only 1 millisievert per year. And sa mga public naman, sa mga tao such as in students, interns, and even the employees of hospital who have been in X-ray department, yung mga hindi nag-ooperate yung mga pumupunta lang sa loob ng X-ray department, ganun. The given dose limit is 1 millisievert per year is allowed also. So, what happens if we already RadTech soon reach this limit required dose in the hospitals? Yung 50 millisievert per year, di ba? We can take rest or compulsory leave ng at least 1 to 2 weeks in order na yung radiation is mag-subside sa sa katawan natin. Yung radiation go down to a low, para yung radiation is bumaba or maging lower or maging sa normal level inside our body. However, if the hospital naman na pinagtatrabuhan natin is madamot sa bakasyon, then there are still many day offs as alternative in order to not overexpose to radiation.